multi-drug-resistant tuberculosis. Resistant, but curable. If you have cough and phlegm for more than 2 weeks, it could be tuberculosis.
And what is tuberculosis?
Tuberculosis, or TB, is a disease caused by a germ that usually attacks the lungs. TB is dangerous, and anyone can get it. It doesn't discriminate by age, gender, or class. But tuberculosis is curable if the treatment is completed. But be careful. The TB germ can become resistant, and the usual medicines will not have any effect on it. The TB germ has protected itself. It has become more resistant. Now it is multi-drug resistant TB. It is more dangerous and more difficult to fight. But multi-drug resistant TB is curable if the person complies with the required treatment.
What is the difference between TB and multi-drug resistant TB?
They are the same germ, but the multi-drug resistant TB, or MDR-TB germ, has protected itself. This means that MDR-TB is not cured with the same medicines we use to cure TB. To cure MDR-TB, we have to use other medicines. These new medicines can cause more side effects. The treatment lasts much longer, usually 18 to 24 months, sometimes even longer. If the person with multi-drug resistant TB does not complete treatment, he or she may transmit the germ to friends and relatives, and could even die.
How do you know if it's TB or MDR-TB?
If a patient with TB continues to be sick, even though he or she is taking all of the medicines, health personnel will suspect MDR-TB and will request laboratory tests. There is a laboratory test that tells if the germs in the phlegm are resistant or not. This test is called a drug susceptibility test, and the results take between 3 to 6 months to know.
How do you get multi-drug resistant TB?
First, because the TB germ becomes resistant when a person is on treatment. This can happen because the medicines did not kill all the germs, because the patient did not take his or her medicines, or because the healthcare worker did not make sure the patient took all the medicines. Second, because a person who is sick with MDR-TB can transmit the MDR germ to another person.
And how is MDR-TB transmitted?
MDR-TB, just like TB, is transmitted by air. When someone who is sick coughs, sneezes, sings, or speaks. This is why we should always cover our mouths when we cough or sneeze. Remember, MDR-TB is transmitted the same way as TB, by air. But if a patient takes all his or her medicine, he or she will stop being contagious after a certain period of time.
Ah, only by air. I thought TB was transmitted by silverware.
No. TB and MDR-TB are not transmitted by using the same silverware as someone who is sick. Nor is it necessary to wash silverware separately. What's more, TB is not transmitted by shaking hands. It is not transmitted by kissing on the cheek. It is not transmitted by hugging. And it is not transmitted by using the clothes or sheets of a TB patient.
And what are the symptoms of MDR-TB?
Multi-drug-resistant tuberculosis produces the same symptoms as TB. They are cough with phlegm for more than 2 weeks, night sweats, fever, weight loss, and tiredness. If someone has these symptoms, they should go to a health center to make sure they are okay. If the TB test comes back positive, then the person will have to start treatment immediately. And don't forget, the sputum test and treatment are completely free.
What is the treatment like for MDR-TB?
Every patient will receive at least 5 medicines, and one of them will be an injection. The duration of the treatment will be approximately 24 months. The physician will decide which medicines are the best and when the treatment will end. Medicines will be taken every day except Sundays. Someone will always supervise the taking of the medicine. This means that a healthcare worker will watch the patient take all his or her medicines every day.
Does the treatment cause side effects?
Yes, the treatment for multi-drug resistant tuberculosis can cause some side effects, like stomach pain, nausea, diarrhea, and pain around the injection site. Generally, the side effects are minor, and occasionally they can be serious, but they are not a reason to stop treatment. Remember, a healthcare worker will meet with the patient every day to administer treatment, talk about any problems, and answer questions. If there is a side effect or problem with the treatment, the healthcare worker must be told so that he or she can resolve the problem. It is very important that the family be aware of the side effects that the patient may have, and that they help the patient get over them. While the patient is taking the medicines, the amount of germs will decrease, and the patient will begin to feel better. In the laboratory, the number of germs in the sputum can be seen. When germs are no longer found, this means that the patient is getting better and is no longer contagious. But be careful. Even though the patient might feel better, he or she has to continue taking all of the medicines. If they don't, the germ will become even more resistant and much more difficult to beat. Moreover, if all of the medicines are not taken, it will be easier to transmit MDR-TB to family, friends, and the community. Not taking all of the medicines can lead to death. We must take MDR-TB very seriously. We all need to do our part and work hard to beat it.
Can a person with MDR-TB kiss and be intimate with his or her partner?
MDR-TB is not transmitted by having sex. But if you are having sex or kissing, you can breathe the same air and transmit the germs. It is better not to have sex until the doctor says it's okay. Remember, in order not to transmit MDR-TB, patient should always take all of his or her medicines and complete the treatment. Also, the following precautions must be taken. Always cover your mouth when coughing or sneezing. When spitting, do it in a paper and throw it away immediately. The paper should not be burnt. The windows of the house should be open for as long as possible to improve ventilation and allow light to enter.
What should a patient with MDR-TB eat?
The patient should eat as much as possible to gain weight and better fight the disease. A good diet may help the family stay healthy. If you experience nausea or stomach problems, try eating smaller quantities of food throughout the day. It is very important that patients with multi-drug resistant tuberculosis do not smoke, drink alcohol, or use drugs.
And what happens if a friend or family member has symptoms?
In that case, he or she must be taken immediately to a health center to have a sputum test. If the test of the friend or family member comes back positive, it is important to let the healthcare worker know that the person may have been infected by an MDR-TB patient. We must always be on the lookout for symptoms that friends or family might have. To beat tuberculosis, we need everyone's help and support.